Hi everyone, welcome to PaceCoding.com Watch and Learn. This is Huang. First of all, I wish you all a very happy, healthy, and prosperous New Year. I'm sure many of you already have your New Year resolution, and I hope that learning ICD is on your list if you are a coder. As you may already know, the ICD will be implemented on October 1st, 2013, which is next year. For sure, there will be a stronger demand for certified ICD medical coders. Because of the complexity of this new coding system, hospitals or organizations will be dealing with a decrease in productivity. That said, for the coder, this is an exciting time for you to excel your career and expand your role in wherever you work. If you are a coding student or someone who wants to change your career, this would be a lifetime golden opportunity for you to secure a coding job by becoming a certified ICD coder. However, if you wait until the last minute to learn about this new coding system, then I'm afraid that you would not be able to handle your workload efficiently or to pass a pre-employment coding exam. Just knowing the ICD is not good enough. You need to know it well. Having said that, I hope you set aside some time this year and start learning the ICD. Since it is a very complex coding system, so it's not easy to learn, but I will try my best to make it as simple as possible. As the title of this video indicated, ICD for kindergarten. Without further ado, let's get started. First, ICD-10 consists of two parts, ICD-10-CM and ICD-10-PCS. CM stands for clinical modification. It usually refers to a sign symptom like cough, fever, headache, or a condition like a broken bone or fracture. On the other hand, ICD-10-PCS. PCS stands for Procedure Coding System. It usually refers to a procedure. A better way to remember PCS is to think of those pictures that make you say ouch, like a needle, scalpel, surgical instrument in the operating room, or a surgeon. Personally, I believe the ICD-10-PCS, in other words, the procedure part, is more challenging compared to the ICD-10-CM. If you have a good documentation and you know enough anatomy and physiology, then you should be able to find the right code for a condition or a disease. However, you may have a very good operative report, but if you don't understand exactly how the procedure is performed, then you may not find the right code. You know what I mean later on. Unfortunately, up until now, I have not found many coding instructors out there who plan to teach the PCS part, so I decided to focus on this instead. Let's talk about ICD-10-PCS structure. ICD-10-PCS has a 7-character alphanumerical structure. The easy way to remember is try to picture a 7-up soda can. So, if you come up with a 4, 5, or 6-character code, then you should know right away that's not a correct code. The 10 digits 0 to 9 and the 24 letters may be used in each character. The letter O and I are not used in order to avoid confusion with the digits 0 and 1. So, remember, no O man and no I. Each character, first, second, third, fourth, fifth, sixth, and seventh, represent an aspect of the procedure. The first character in the code determines the procedure category or section. Think of it like each department in a hospital. For example, our department radiology department, obstetric department, physical therapy department, etc. The second character is the body system. For example, central nervous system, gastrointestinal system, etc. The easy way to remember the second character is to refer to doctor specialties. If you have a heart problem, then you should go see a cardiologist. Likewise, if you have a tummy ache, you should go see a GI doctor. The third character is called root operation. In other words, the precise procedure is performed. For example, biopsy, fracture repair, kidney transplant, gastric bypass, pacemaker implant, etc. For now, I just want you to focus on the first three characters only, because it's very, very important to get it right so that it will lead you to the right ICD-10 PCS table. If you don't have the right table, then the remaining character will be useless. To help you get the right table, pretending that you are a patient and you need to have a surgery, I want you to answer the first three questions. Which department am I going to be at? In this case, apparently, the OR department for the surgery. So you get the first character correctly for medical and surgical. The next question is, who is my surgeon? Let's say you're going to see a urologist. Then it will help you identify the body system, which is the urinary system in this case. The last question you need to ask your doctor is, what procedure that I'm going to have today? Well, let's say the doctor tells you that you're going to have a kidney stone removal. Then the removal of kidney stone will be the root operation. Below is an excerpt of the ICD-10 PCS table. This patient had a kidney transplant. The first character determines the section. Remember, the hospital department, this patient is going to have a surgery, so the digit 0 is for medical and surgical, which will be 90% of the case that we'll be working on. The second character, remember the question, who is my surgeon? What is his specialty? The urologist in this case, so it is related to the urinary system. The character T identifies the urinary system. The third character, remember the question, what procedure that I'm going to have today? This will help you identify the root operation. In this case, the kidney transplant, and the Y character identify the transplantation. Next video, I'll go over the 4th, 5th, 6th, and 7th character, which is the body part, the approach, the device, and the qualifier. That's enough for now. Thank you so much for watching. Any comment or suggestion, please kindly let me know. You all have a great day.